Thank you so much for joining us this afternoon, and we are excited to bring to you the webinar for today, Unprecedented Preparedness in the Age of Unprecedented Disasters. And it will focus on our AI-powered simulation design that is a part of our disaster readiness simulator. My name is Jesse Bliss. I'm the Director of Program and Partnership Development for the National Environmental Health Association. And I've been leading this project for the past 4 years as we sought to develop enhanced ways to address the changing frame and issues that we face during disasters as we think about how to communicate and collaborate effectively across the entire public health system to address the threats and challenges that we face. At NEHA, our mission is to empower the environmental health workforce to meet evolving changes, and this project was an opportunity for us to do so. As we started to look at how we could present and share how to address issues related to concurrent disasters, and to be able to address the challenges that are associated when we already have extremely stretched resources that are impacted by concurrent or cascading events. So the Disaster Readiness Simulator project was born in the summer of 2020, and it was clear that local health departments needed more tools to support planning and how to manage and prioritize limited resources during these concurrent events. Initially, we focused on resources which are reflected on our concurrent disaster hub, but then we went around piloting exercises during the summer of 2022, and I'd like to thank those who participated in those pilots. With the support of our partner agency, CSTE, we worked to do pilot exercises in the city of Cape Girardeau, Missouri, and Williamson County, Texas, and Johnson County, Kansas, for the state of Tennessee, in collaboration with Wayne County, city of Detroit, and the state of Michigan. And I just have a lot of gratitude and thoughtful appreciation for all those that were involved in those initial activities, as well as to the participants that have helped in leading out the development of these resources, including our partners from the University of Utah, Dr. Kimberly Schoaf, and Justin Snare with Signal Solutions, who you'll be hearing from later today. And of course, none of this would be possible without the support from CDC's National Center for Environmental Health and ATSDR for their funding support, allowing us to pursue addressing these needs in this time when we can't continue to address the continued challenges with the frequency and size of disasters by continuing to do it the same way we have all along. Today, I'm joined by Justin Snare, CEO of Prepar.ai and Senior Advisor here at NEHA. Also, our panelists, we have Honorable Tim Hatch, who is an administrator in Alabama Department of Health. We've got Stockton Trujillo, an emergency manager from Clearfield City. Sandra Long, an environmental health manager for the town of Addison in Texas. And we have Larry Ramden, President-elect for NEHA and Director of Training, Evaluation, and Technical Assistance for Metro South Public Health Alliance in Massachusetts. And finally, we have Dr. Megan McGinty, Senior Executive Health Emergency Preparedness and Response at Tetra Tech. So thank you so much to the panelists for joining us today, as we will be going forward and showing you the simulation activities and exercises associated with the Disaster Readiness Simulator. A quote from our executive director and CEO: "In an age of unprecedented disasters, we need unprecedented solutions. Preparedness must evolve." And that's what NEHA's Disaster Readiness Simulator is tackling. The importance of evolving disaster preparedness to address the modern challenges can't be stressed enough. And what we have done with the development of the Disaster Readiness Simulator is look at a new productive way to streamline resource management, to promote effective decision-making supported by data, and given us a tactical view to be able to realign targeted human resource risk and allocations so that we could get the right people doing the right thing at the right time. Some of the challenges that have existed in exercise design and simulations in the past have unrealistic expectations or understandings of what the capacity or capabilities are of partners and within the agency itself. And so during the exercise play, we might have a black box of resources that kind of appears where we say that a certain partner will participate and deliver services or resources. But there may not be a memorandum of understanding or specific agreements in place allowing that to happen. Additionally, we may over-assign specific functions to staffing that supersedes and goes above and beyond the staffing resources that we have to be able to deliver that. And so in order to address this, when we're looking at modern crises that overlap like concurrent disasters, we wanted to ensure that we could anchor the work that is being done when we're doing our exercising and engagement with our partners in reality. We had collaboration gaps related to disjointed communication and planning, which hinder effective disaster response and delay critical actions. So the Disaster Readiness Simulator utilizes an AI-powered software as a service platform that revolutionizes disaster preparedness for public and environmental health professionals. It looks at specific capabilities and helps participants from the jurisdiction to be able to map and understand their human and program capacities to help to align their emergency response. It personalizes the simulations in a way that makes them hyper-localized so that the jurisdictions can ensure that they are addressing where they see the biggest challenges, as well as understanding the nuances that each jurisdiction may have. So depending on where they want to focus their attention within the hazard and the simulation, they're able to do so through the use of this novel solution. It also facilitates collaboration through the interactive exercises where you bring together all of your partners across the health system that are part of your response and engages them in a way that tests their localized capability and capacity to address these threats. I'm going to show a brief explainer video that describes what we were seeking to achieve and where we're going with this.
We live in a new era where concurrent disasters are the norm, overwhelming and spreading jurisdictional response resources thin. Yet current disaster plans do not accurately prepare for this reality, limiting how ready we can be. Planning and practicing together and knowing available human capacities are critical to prepare for concurrent disasters. But accurately portraying human capacity and changing needs is hard to do. With NEHA's Disaster Readiness Simulator, you can. Our simulator helps you understand and test your organization's and your partner's emergency response capabilities and capacities. Although this is a complex process that requires time and cross-jurisdiction collaboration, the investment is worthwhile, as it helps you consider how best to reallocate personnel to the roles that need specialized expertise. The simulator provides readiness insights on the complexities of concurrent disaster response, helping you prepare your organization for what's to come. NEHA's Disaster Readiness Simulator. Clarity amid complexity.
So what we have here is a first of its kind disaster readiness simulator that provides data-driven decision-making. It integrates real hazard data and allows that to be used in grounding the planning for the response of an agency. It supports, understanding what the capacity is and how do you optimize based on who is able to provide services to address the threats and what the capacity of an agency and partner together to be able to address those challenges as they appear during a disaster. Strengthening collaboration and building connections and unified goals across agencies and partners by enhancing clear communication and modeling overlapping crises to understand what those compounded impacts are related to concurrent disasters. Finally, it'll work to deliver reports that are actionable and help to refine plans for future use. So each one of these components, as we engage and support the delivery of an enhanced readiness portfolio and system, strengthens the ability of jurisdictions to identify where their challenges and weaknesses are, build upon their strengths, and make decisions on how to address and direct individuals towards the weaknesses that they find. In this particular focus, we're looking at environmental related threats present in disasters. So those are related to water, safe food, sanitation, air quality, and the like. And those are critical functions that must be protected in order to prevent morbidity and mortality during disaster events. The resources are available to all U.S. counties, where we developed specific hazard modeling and situations that are allowing each of the counties to be able to participate and do customized simulations that are responsive to their local needs. It's cloud-based, and it also is built upon HIPAA and SOC 2 standards to make sure and safeguard data that is held within. The Disaster Readiness Simulator is a complete project that goes through from at the very beginning of mapping capabilities and capacities of your local agencies to then working to validate and assure that what is believed by the agency is shared between all parties that would be involved. That information is then put within the designer, and then the designer is utilized by a planning committee that puts together their specific focused areas, and then they build that and it puts it into the simulation. Finally, after you do the simulation event, participants attend and engage with the injects, questions, and engage in a hot wash before completing the final reporting that is then provided as a simulation report to be actionable afterwards. Where we're going to be focusing for today's activities will be within the simulation designer. But just a couple of quick screens, you can take a look at the entire simulator. This is where the agency admin would begin with the dashboard, followed by that admin who would designate which capabilities are done within the health agency and by which units, and assigns the capacity mapping process to the unit managers. Unit managers then in turn enter in human resource information for the capabilities that the admin assigned to them. And then they invite partners to share information about their involvement in the capability. When the simulation planning group uses this data, they then engage that information into the simulation content, which we will be demonstrating in the webinar. And then this is all sent back to the simulator, where participants are brought back together for a digitally supported tabletop simulation exercise. It has simulation injects and discussion questions that are developed during the simulation design process that specifically focus on allowing staffing allocation decision makings so that the FTE that are available within the jurisdiction and among partners can be adequately and directly allocated to support each of the threats and hazards that are encountered. So with this, we're going to be focusing here on the simulation designer component of the activity. And I'm going to be turning it over to Justin Snare to continue and walking through the demonstration with you all. You're on mute, Justin.
Of course I am. Thank you, Jesse, and thank you, panelists, for joining. And thank you for the audience for registering this webinar very quickly. I think we've reached nearly 500 registrants, so that's really exciting. So I'm here to introduce you to the simulation designer, which I was one of the primary folks involved with the development of it. It sits within the broader disaster readiness simulator. It's AI enabled. It is not an easy button for simulation design. It is a co-pilot for the creation of simulation content to be used by the disaster readiness simulator. It ingests a ton of information about that agency that Jesse just demonstrated. They go through a process, and it holds that agency to that context when they're designing. So You don't have to have AI experience to use this. The experience you need is probably limited to knowing how to text. And then when voice to text is turned on, it's just knowing how to talk to it. So what we have today is a group of emergency managers, environmental public health folks, preparedness folks, folks that have been in the business of emergency management and for decades, and they're going to pretend to be an exercise planning committee. I'm going to be the facilitator, and the sim designer is going to ask us questions, and we're going to respond to it, and you're going to observe us talking through it as if we're 5 people at a table, figuring it out, determining what injects and topics that we think should be included in this simulation. And you'll see the sim designer support that through content generation, education, so we can ask it questions. It's also going to adhere us to certain game rules. And I'll explain that as we go through it. So what you're seeing here, this is what the simulation design team would start with. It's the orientation to the sim designer. And really, you can ask any questions here. You could ask it to show me all the data. I've given it a little context. We're going to be pretending to be a place called NEHA County. It's in Tennessee. It has it's a bustling area, about 120,000 people. It's not a major urban environment. It has a lot of tourism. It also has a lot of risks of windstorms, flooding, and wildfire. And for today, we're going to be demonstrating a concurrent disaster design involving a pandemic followed by a wildfire. Okay. And so the sim designer now has that context and all of the data. So we're going to start. So welcome to the NEHA County Concurrent Disaster Simulation Design. Thanks for joining us, panel. And so what we're going to start off with is the sim designer is going to share and establish the current conditions of the pandemic. What's important here is that this is going to standardize this pandemic across all users across the United States. So for 3,000 counties, they will experience and have to design around the same pandemic. So when they simulate this later, that will give us we'll be able to observe how they interact with that standardized event. Okay, so most important here is does anyone have any questions about this scenario? The current conditions. We could ask it to explain itself. We could ask it to explain the technical information, or we could challenge it to say, change something, and you'll see what happens. So, Megan, any questions or anything for this?
No, but I did want to say that as I'm getting older, my vision is limited, and I needed to zoom in to see better. So if people need to see better as well, they may want to pinch their trackpad.
Is this any better? I just zoomed in.
Expand their trackpad.
Yeah. Is this any better?
I'm not sure because I already pinched.
About the same size. If you actually go to, could zoom like Command and plus and zoom in, it should actually increase it a little bit.
Okay. So what the sim designer has been given and now is presenting to us as a design committee is the standardized current conditions. Okay. So here I could say, well, I don't know what an R naught is. Okay.
Could we have it explain what an R naught is for us?
Sure. It's doing it right now. So I could also, this seems hard. We could say this is too hard. Why don't we make this pandemic easier? And it's going to resist that. We've coded it to not allow a user to change this too much other than personalizing it for their county. Okay. So for example, well, that seems hard. Make it easier. So it won't let us change this R naught. It won't let us change the conditions of the pandemic. Okay, so we're going to move forward and design around it. Okay, so the next step starts with us, just like an exercise that we would normally be working through. We're going to establish some functions or capabilities. If this were an HSEEP exercise design, we would establish capabilities to focus on. What we have here is something called the EFEPR functions. Think of it, it's a part of a capability framework that shows what environmental public health does in the context of a disaster. Okay, so the sim designer knows it. So I'm going to tell it to, I want to view it. So I want to go with 1. And it's going to give us all of those functions. And what I would like you guys to think of is in the context of a pandemic, what functions do you want this simulation to focus on? Ideally, pick 3. You can pick as many as you want, but this will establish some of the context that'll show up in the simulation, okay? So, Sandra, what usually comes to your mind in a pandemic from an environmental public health perspective? What are you concerned about?
Item number 1
Okay.
and 6.
6. Okay.
And let's go with 11.
Okay. Does anyone want to change that, challenge that?
Yeah, this is Tim. I'd like to challenge that. Add not to disagree with Sandra, but add number 2 for sure. Because looking back on the COVID pandemic, the resources were quite stretched thin. Speaking mainly of personnel.
Okay.
Okay.
Anyone else? Stockton or Larry? Larry, you're muted right now.
Thank you. I'm thinking about number 9, especially for the pandemic around.
Okay, so we have 1, 6, 11, 2, 9. What about solid waste or debris management? Medical waste surge, things like that.
Yeah, I was thinking that the solid waste management may have been covered under 11. Maybe I'm making assumptions there.
Okay. It'll reconcile it.
Okay.
Do we want to add 4?
I would take 6 away. Because just in this scenario, right? Like we're talking about a pandemic, not a natural
the wildfire.
disaster where people are likely to be sheltering.
Yeah, there's no shelter yet. The
Yeah.
wildfire, we'll design that next, okay? Which, Sandra, that should absolutely come up because it will be complicated by the pandemic, okay? So let's go ahead with this. So we told it what we wanted. You could also have typed this in plain language. You could just say, I'm worried about risk assessment. I'm just using the numbers because it's faster. But you could just say, I'm worried about shelter, hazardous waste, or anything else, and it'll interpret that and put it into the correct functions that you want to select, okay? So this, if you're used to HSEEP, this is kind of like the capabilities that we're going to exercise today or design for. Let's move forward. Is everyone good with these? Anyone want to add anything or take anything away?
Justin, I just wanted to quickly answer. Nikki Lemon had a question about, is this simulator only for county local use, but can it be used at the state level?
The short answer is everything is technically possible. The longer answer is not next week. So like it's certainly, there's a demand signal for a lot more than just county level, but we're starting with county level, and Jesse could speak to that more specifically. I think the progression we're going to go through is individual counties, then groups of counties working together in regions, and then state level, and then but that would seem like a logical way to go. But that's his side of the software. So
yeah, I think I could just briefly add in there, we're looking at where disasters happen at the local level and where the population is impacted. Well, the coordination and organization is often higher up and is deeply integrated within the state level, but working on the specifics of which jurisdictions are impacted by the disaster is the focus of the resource at this time.
If I may, it really doesn't matter the jurisdiction, really, it's about the situation. So I believe that it can be utilized at the state level, not to make a state level plan, but to produce an exercise, because it's event based and not jurisdiction based, if I'm correct.
Yeah, there's a limitation. The software to sign up right now would require you to be a known county, but that could easily be changed depending on the interest signal. So it's just right now it's designed for counties, not groups of counties, not states of counties. But that's not saying it's not what you just said, Larry. It's just that it would be something changing in the way that it's built, a slight change. So I'm going to assume these are good, and we're going to move on to the funner part. Is Okay, now that we've encountered the current conditions, we've selected the functions we want to focus on. Now the sim designer wants us to design the scenario specific to Nehi County, the conditions of the pandemic, the functions we selected, and anything else. And it's now you're starting to see some interesting things like it's not just the generic county current conditions, it's starting to pull in data and unit names that came from the simulation. For our purposes, this is synthetic, but you can see FTEs showing up. You can see unit names showing up. Those are specific to the data that came from the simulator. So this is Neha County's synthetic information. We've populated it with a bunch of program names and staff. An important point here is that we do not ingest in the sim design. The AI does not encounter the names of staff. Okay, so that's really important. We ingest the data about an individual has a unique identifier and they're associated with an FTE. We don't ingest people's names. Okay, that's reconciled back on the other side in the simulation, but you'll never see a name show. You're not going to see Bob show up in the simulation. Okay. And that's just a safety and a privacy issue. So, okay, so let's read through this. So, the initial attempt here is that it's saying we have a pandemic. We're dealing with coordination and risk assessment. We have some epidemiology units from public health involved. We're dealing with some solid waste, which we said we wanted to. We have hazardous material and some other things that we have indoor air quality. So those are all the functions we had talked about. I just know this thing, so I'm going to say add more details, addresses, POIs, and complication. And then we can go from there. So this will change now based on our feedback. So you guys should just start debating. So Neha County, you guys are the planning committee for this simulation. What do you want people to encounter? Shout it out, add topics. It'll keep iterating for as long as we want, and it'll be rapid. So
I want people to encounter a need for coordination as like the healthcare coalition. How is public health coordinating with the healthcare coalition and hospitals and healthcare facilities in Neha County?
Okay, let's add that.
I would like to see some information on isolation and quarantine, some guidance around it.
Okay. So an important part of this is that we can normally get through when this is on a table in front of you and you're using the voice to text. You could just talk to it. It'll capture everything. You could probably get through an entire design minimally in about an hour. Sometimes I can get through it in about 20 minutes of only typing about 30 words, and it pumps out a good simulation. So we have some isolation protocols. We have some healthcare coalitions have been added in. We added in some of the addresses. These are fake addresses for a fake place, so these aren't real. It factors in, I gave it context initially that this county relies heavily on tourism. And that added that in earlier. So this is what the participants would encounter in the digital tabletop simulation. So this is like, if you were used to an HCEP situation manual, this would be the scenario that's described at the beginning of the simulation or the exercise. And we'd encounter different injects and questions as we go. So Stockton, do you want to add anything from an EM perspective? Stockton, are you on? You're muted, bud.
Sorry about that.
Okay.
I was thinking some supply chain management issues.
Sorry. You can also see that you don't have to type correctly. I can't type when I'm being watched by 500 people, but you don't have to. It just sorts it out. Okay, so let's just review. We added in a couple things. We have the tourist stuff I added in the beginning. We have isolation protocols. We have the addresses I asked to come in. I like to always add in the EPH is not directly represented in the EOC. They're represented through public health in this case. It adds for some very interesting coordination and comms issues in the injects. We have the healthcare coalitions that Megan wanted. We have supply chain issues, okay? And the hazardous materials that Sandra, you had mentioned earlier. So as we're iterating with this thing, it's constantly trying to adhere to these things we told it to be successful with, and those were the functions, the pandemic current conditions, the location and context we gave, and any instructions we're giving it. We could sit here for forever just talking to it, but let's assume this is good, okay? So now we're going to get to inject design. So injects are curveballs. For those that don't know, they're the progression in a scenario. They usually result before some questions and discussion occurs. So the sim designer usually advises people to do about 3 to 5. We could ask it to give us its initial attempt, or we could give it topics. So I'm going to just say we want to do number 1, and in the plainest language possible, can you all take turns telling me what you want to show up?
I want some tourists spreading misinformation about the pandemic.
Tourists spreading misinformation, okay? We'll watch out for those tourists. Okay, what else? Sandra, what else?
Let's go with a short-lived virus not associated with the current pandemic.
Oh, fun. Like okay.
Like noro or something.
Associated.
Something airborne.
You want airborne? Yeah.
That would be fun.
Yeah, something airborne that mimics similar
airborne, please. Sure. Let's see what it picks. Okay.
similar symptoms.
Stockton, what would you like for an inject?
Honestly, I'm siding kind of with Sandra here, and I'm thinking a mystery virus that's not associated with the pandemic.
Okay.
Different symptoms and whatnot.
Okay. Tim.
Yeah, since NEHA is actually hosting this, I'd like to see about us looking at the relevance of environmental public health on this disaster. What tasks are out there? Because if we look back to COVID-19, restaurants closed, hotels weren't being used. If it's in the summer, people weren't congregating in swimming pools. So what other tasks would we as EH professionals be doing?
Great. I always like to add in, I don't really like to add it, but adding in civil unrest makes for interesting injects. Okay, does anyone else want to offer any? That should give us some good ones, but let's see what it comes up with. So what you're seeing here is on the left side is the conversation we're having with one AI, and on the right side is the content generating AI. I could talk with this thing for a while on the left, and it will generate on the right. I could ask it, you can't ask it apple pie recipes, it will reject it, but you could ask it to explain what an inject is. And it won't make an inject about that question. Okay, so it's going to ignore non-relevant things. So it's part educator, okay? It shouldn't make an inject about an inject, ideally. And so it didn't. That's great. And so we can have simultaneous conversation on one side, educating you as a group, asking questions, asking you to explain its rationale, and it won't mess up your right side content. And the content on the right is what moves forward, okay? So there's actually 3 different AIs on this one screen. One of them is turned off. It's the voice to text. Okay. You're still on sync. Yeah, I didn't add in EPH. Okay. So now it's going to look at the EPH roles in every one of these injects. So Tim, we complexified it slightly. Okay, so let's move forward with these. Okay, and now it wants to design questions. Okay, so I know that this tends to make them a little less complicated. But what's happening here is that there are 5 questions that NEHA said that they wanted asked for every inject, whether or not they were obviously an EPH related inject or not. So say if there's a civil unrest inject, it's not immediately obvious what the EPH relevance is. But I know there is, Tim knows there is, Sandra, you know there is, like there's going to be something relevant with an EPH. So what we have is for every inject, you can design anything you want, but you'll always be asked those 5 top questions. Okay, and those are hard coded in. You can't change them. And so each of these injects will have additional questions added that we can iterate on. So there's 3 added on here that we can add on to. We can add more details. Okay, so I'm going to show you the ones that we're having asked. So we want to know everyone that goes through this exercise will have to answer the question, what is the EPH concern in this inject? No one can avoid it. You could yell at it, you could take it out, you could say don't include this, it will always include these 5 questions, okay? So the rest of them are generated by the sim designer right now, and we could add more or take them away. So are there any questions? Let's take a second to review this. I'll just scroll slowly. Are there any questions or topics that you just absolutely want added in for discussion by the participants in the simulation? And I'm going to go Tim.
Yeah, I'm just kind of going back to the personnel resource. You know, we did input the number of FTEs that we have, but based on the blossoming scenario, and we haven't even gotten to the concurrent, what expectations does the simulator have on shortages? Because, you know, if it is a pandemic, you're working more than 8 hours, you may have 2 shifts. I know we're not talking, excuse me, about sheltering right now, but what impact on human resources are we going to have?
Great. So it'll start adding those questions. It's going to generate in a second. Okay. So moving on, it's going to generate the list of questions. And so anyone that's participating in HSEEP kind of exercise, you would encounter these questions as part of a normal tabletop exercise. These will be sent forward into the simulation, and you'll encounter them digitally, and you'll make decisions around staffing for some of them, but not all. And sometimes this step takes a second to generate. So, okay, so we see our required questions. We see some questions about leveraging current staff and resources. We have absenteeism now added. And so I'm going to move us forward. Okay, we're going to get into the spicy part of the sim design now, where there's 2 disasters. Okay, so like we just did with the pandemic, you're now you're in the pandemic. You've made staffing decisions. Okay, you have all that designed, and the design you just did is now complicated by this wildfire. And so it'll generate in just a moment. This wildfire is based on a wildfire that happened in Tennessee in 2016. This is just the current conditions. This isn't the scenario design yet, okay? So this is what we're dealing with. Let's take a moment to look at that. And so we have some of the stuff we were talking about with the pandemic, but we also have overwhelmed staff, critical infrastructure such as water treatment facilities and major hospitals are impacted. We also have private wells impacted due to contamination. And so that's we're going to require sheltering, we're going to require water supply, we're going to require coordination, staffing. But first, like we did before, we're going to determine what functions we want to focus on. For this one, why don't we just say plain language to it, okay? What are you, I'm going to go down the line. Megan, what are you worried about? What do you want to focus on for this part of the simulation?
Like congregate settings. So if people are in shelters, the spread of the pandemic there.
Okay. Tim, what do you want to focus on?
So I hate to bring this up, but recommendations from the health authority about masking, social distancing, the use of hand sanitizers, that type of thing.
Okay, so non-pharmaceutical public health interventions.
Yes, sir.
Sorry, I can't type. There we go. Okay. What else? What's an issue?
Weather and
Building-
airflow patterns. Sorry.
Okay.
Larry. Yeah. Think wildfire, okay? Wildfire.
Yeah, that's
Pandemic
right.
we already designed. Think wildfire.
Weather and airflow patterns.
Okay.
Building on the
Stockton.
non-farm,
Megan, what?
Justin, building on the non-pharmaceutical interventions, I'm just thinking like supply chain issues, if people are thinking they need to mask, and both between the pandemic and the wildfire, there's demand for masking.
Right, but for different reasons, right? That's interesting.
Right.
Stockton, what would you like?
I'm thinking to monitor and ensure the integrity of water systems.
Okay. Sandra, you're the last one.
Let's go with staffing and making sure that your staff is protected and not becoming ill.
All right, let's see what it does. So this is another attempt. I could have gone through and shown you. I could have said, tell it specifically what numbers we want, but now we just kind of blurted at it, right? This could have been a conversation we were just having and it recorded, and it's going to try and find the most appropriate EFEPR function to align with what we just asked it to do, okay? Some of the things we said aren't in the EFEPR functions, and they're more broadly within HCEP or FEP. But this is trying to take some of these issues and align it with what we want, okay? So Larry, your weather patterns and airflow, not quite, but it kind of put it into indoor air quality. We can tell it that's not quite right. So this gets us about 80% of the way there, and it's best when we have experienced professionals, EPH, public health, HPP, EMs, all working together to give it that last 20%. So it's not a predictive AI. It is writing words around a lot of instructions, but works best when we work with it. So do these fit for what your expectations are for this, for a wildfire event in a pandemic? Okay. So now we get to the fun part again. Now we have a pandemic with a wildfire, okay? It's going to take its first attempt to generate it. So now you're going to start seeing the things that we told it to do, the functions show up. So we have emergency shelters, maintaining physical distancing and implementing strict hygiene protocols in this shelter. We have certain teams in the agency data that's being pulled in. We have water systems that are under threat. We have coordination. Somewhere in here, there's probably supply. We have this one right here, balancing resource between immediate demands of wildfire and ongoing requirements. So I think it did okay. It took in our plain language, identified the appropriate functions, and then customized the scenario design based on the current conditions and used some of the data from the simulator. Okay. So is there anything you guys want to add or change? I'm going to tell it to add more addresses and POIs. EPH is still not in the EOC. Megan, what would you like to add, if anything, or does this kind of represent what you had in mind?
Can we add more challenges around like workforce shortages with kind of the dual emergencies, as well as kind of just overburdened, burnt out staff?
Yep.
And I guess I want to ask a question to Stockton from the EM side. What are we looking at? I know with pandemic, we had a problem with obtaining requests for human resources from other partners due to the fact that everybody was stressed. But in a wildfire situation, is that something that we would want to put in there about deciding on reaching out to sistering or neighboring counties and stuff?
Yeah, Tim, I think that's a great point. As we've seen in the past years, wildfires consume a lot of resources and a lot of individuals. So I think that would be wise early on, especially with the given scenario up to 20,000 acres and growing. I think it'd be wise to reach out to neighboring jurisdictions and counties to get that help and support.
That also begs the question, are there additional partner agencies that we can partner with to provide some of the communications and outreach around it?
Could also look at doing some Emacs and whatnot.
Okay, it's just generating for a second. Still writing. You guys are coming up with good stuff now, but your material is showing up in contextually relevant ways now, which is the important part here. So when at the end, if you're really not happy with what's been generated, sometimes it just won't get an acronym right. You can still edit out as the last step the content before it moves forward. Okay, so I'm gonna throw in this last one and then we'll move on. Okay, but so we're seeing addresses show up. We're seeing it adhere to the pandemic and the wildfire conditions. We're seeing the functions that we told it we wanted to, and then we're adding in all these additional variables around Emacs and MOUs and other things. Okay. This was yours, Megan, I think. Demand for personal protective equipment. It's being complicated by the dual disaster. Workforce challenges. We've activated several MOUs with neighboring jurisdictions. And so to get this whole paragraph, I typed in about 2 words to produce it, okay? I think in total to make this scenario, is probably 25 words of typing. You would obviously sit in a room debating these things and it would be listening and you'd be submitting enter and it would be adjusting over and over and over again until you're satisfied. But what this is demonstrating is that it's generating relevant scenarios based on a bunch of rules and adapting itself to what the panel is saying, okay? And it's quick. So let's move forward with this. And this is the same thing. We're going to start designing the injects for this particular concurrent disaster now, okay? So this is 2 disasters at once. Do we want to see what it offers this time? We haven't done that yet.
Yeah.
I bet it's going to say water. It has an inclination to say water and vulnerable population things, but oh, there we are. But
Justin, I think it's very important there, that last one, the mental health concerns. I think that's something that we plan for after the fact. So having that, pre-known is really important. So thank you.
Yeah, so all I did for that, I just said staff safety and burnout. That was the line. It interpreted it into something relevant for an inject. So
it's not to have us as a planning team not reinventing, to be looking at the similarities in response to both events. So what I'm saying, if there are things we're already doing for one that we should be doing for the other,
yep,
we're already there. Are there any additional?
So what you would see in the simulation is that you went through a process where you moved staff around and made decisions for the first disaster. Those staff that you moved around, for example, it was accounted for. Now, when you encounter another disaster and say, I want to move Bob, Bob has already been moved for the pandemic. So almost like your ledger has already been, you've used someone and it'll warn you that Bob is already in the pandemic. So that's how it's maintaining sort of this alignment. It's holding you accountable to the staffing decisions you made. It's hard to see that right now because we're not in the simulation. But if I said I moved Bob to go do shelter coordination for the pandemic, and then Bob was actually in charge of wastewater treatment plants, Bob is not available. So, or you have to move Bob out of the shelter. Okay. So that's it's a human resource simulation and capacities. So Let's say we go with these. I want to make sure we have some time to discuss at the end. So now we're going to do discussion prompts. Okay, so same thing as before. What kind of questions do we want to show up? Again, it's going to ask those top 5 questions no matter what I tell it to do. The Sim Designer AI will reject any changes to these top 5. You may seem like, why? Why do we want to force this? It allows us to see how people respond. If they enter no relevance to EPH, that may be where they're at, but it gives us a signal and other people a signal that there's an educational opportunity here. Saying like we don't want to force feed it to them, but we want them to acknowledge their place where they are right now. So these questions also allow us to compare across jurisdictions later to some degree. So it's going to generate for these injects again, the top 5 questions plus any generative ones now. Like I said, this step takes a minute. It's doing a lot of work. So we have our inject that we wrote for the shelters. We have top 5 questions. It added in several more. And so I'm just going to give you guys a chance. I'm just going to scroll through these and you can holler out. Has our staff absenteeism question. It's generating for my last prompt right now. So give it a second. I told it to add in more details higher up. So can you guys imagine sitting like with a group of like different folks in a jurisdiction, laptop opened on a table, someone's pressing the space bar to get the voice to text going. You guys are just talking amongst each other and it's capturing that. And all it wants to do is make sense of what you've said. You don't have to know what an inject looks like or what an ideal question format is. But could you guys see yourself doing that, just sort of talking with this thing or talking to each other with this thing listening and just kind of generating content for you? I'm seeing some comments in the chat. I saw 100%, so that's great. But for the panel, could you see this kind of like complementing a process, not replacing it, and just speeding things up? Rather than going away for 2 weeks to iterate on the content, it's done pretty fast. Okay. Tim.
Yeah, a matter of fact, I think it would help in as a impartial observer in a way that, when disagreements come, not disagreements, but differing opinions come about, you add it in and it'll tell you what the scenario outcomes could be. And so it helps think outside the box. So yes, absolutely.
So I'm going to ask it to explain to me staff absenteeism and what questions I could ask. Okay. Then we will, we're quite ahead on time, Jesse, so we could spend more time with Q&A at the end, I think, if you'd like to, or we could discuss the content at the end, or we could, it tries to explain to me what staff absenteeism is. So at any point in this process, you can step out of the design and just ask questions, okay? And so now it's coming up with all of these interesting questions around absenteeism. Okay, I'm just going to try and integrate those. Okay, and it's going to generate. And so the Sim Designer is part sort of librarian, part specialist in environmental health, emergency management. It's not an expert. It's part documenter, it's part facilitator, it's part teacher. Okay, so if you're a one-person shop somewhere, you just got 5 new folks helping you. Okay, in this box in front of you. So we have some of the absenteeism questions. So I'm going to move us on. And this is going to be the last step. I'm going to show you what this just all generated. And so we had a conversation going on. Sometimes we interrupted the process by asking questions. What it was doing was capturing relevant content through the entire process and moving it into this, what looks like what folks would maybe call like a situation manual. But for our purposes, there is no situation manual. It just gets sent back to the simulator, okay? So it captured the simulation and scenarios that we wanted, the injects that we had, and the questions, okay? We did it in about 35 minutes. This would obviously be longer and much more debate, and you would have other constituents showing up. But in about 35 minutes, we generated the content that's contextually relevant to run a simulation. And that's where this would end for my part. We would push this button, and it would go back to the simulation simulator, and then the team would start setting up the simulation. Okay, but we're not going to show you that today. You're going to see that page, and I'm going to turn it back over to Jesse somehow. Stop share. Jesse, the floor is yours.
Thank you very much. Just a moment here as I get my sharing back up. Okay, so thank you, and Justin, and to the panelists for participating and going through a simulation design activity together with us. I think there's some questions that have been showing up in the chat. People are beginning to think around use cases for this, considerations of more simplified use or ways that it could be, further enhanced. We want to hear and learn from each one of you. We are going to be opening this up to a small group of individuals to begin starting individual use. And those early adopter users will, act as a litmus test for us, providing feedback and guidance on the process, on what recommendations are, the interaction with the simulation designer, and other aspects of the simulator altogether, including the workforce enumeration components. We would love to get your support in communicating with us. And so there's an opportunity as we look for, others who will collaborate and engage to help us to do the refinements on this. Looking at investments in development and accessibility, there are other hazards that can be included within here and other opportunities to be able to strengthen our ability to address environmental health threats that exist within disasters and emergencies. Sharing expertise to help enhance the accuracy and functionality when you see things where it could be more responsive to your experience and what you've seen in your specific jurisdictions. In doing a demo with a couple of jurisdictions, one of the things that came up was, well, we'd like to do this on the ice storm hazard, but we would like to focus on a hazmat incident because this is one of the challenges that we have within our jurisdiction. And so we asked it to include a tanker turnover in the jurisdiction. And we developed then around that. So the flexibilities really are there to help to make this more customized, but we would love to have, your experience and feedback. So we will we have an interest sheet that I'll share the QR code in just a moment. You can also just go to that on our webpage and be looking for NEHA Disaster Readiness Simulator, and you'll see both the video that we showed earlier, as well as a form where you can request more information and details. Please do participate also in the request for kind of the sentiment feedback on today's webinar. That will also help to inform us and guide our next steps as we look at where the interest is, what the demand signal is for these resources, as we look at ways to increase the readiness of and resilience of our jurisdictions. And there's a serious note to this. We can't overlook what has happened in just over the past year. We have lives lost, homes that are destroyed, both by fire and by hurricanes. These are our major issues. And we can't continue to just, keep throwing the resources at this in responding or reacting to the disasters. And so we're wanting to ensure that we can work on the front end of this to be more ready, more collaborative, increase communications and collaboration to help us to contribute to a more resilient and prepared community. So here's a link. You're welcome to email me. You're also welcome to please sign up to join the wait list of those interested in participating and engaging with us as we go forward. And if you have other comments or concerns or questions, we would love to hear from you. Anything else from the rest of the panel as I open it up before we close out? We can actually let people go a bit earlier today. I know there's a lot happening, so we really appreciate the time that they've invested. But is there any other considerations or things that the rest of you would like to share before we close?
Andrew?
Yes. So while we all do things kind of the same, we're all very unique in what we do and things that we deal with. And the simulator actually allows this to add things that are kind of unique to our own situations. Like in the wildfire scenario, I noticed we didn't add anything concerning um, pets and reallocation of animals and things, which again are considerations. Or when we were looking at the sheltering, we could ask questions about sheltering and what happens to my shelter if I lose power, can't get water to it, and things like that. I think it has a lot of versatility to it that allows us to look at the situations from a variety of aspects. And some of those would be aspects that are unique to where we are and how we handle things.
Thank you so much, Sandra.
Just, do you want to, there's a few questions I think that would be helpful in the chat, particularly around what's currently possible for different types of disasters. And so maybe we could just go through those high level ones so they know that this is for currently for 3 sets of disaster combinations: pandemic ice storm, pandemic hurricane, pandemic seismic event. And the counties that come in, they actually can't pick a disaster that they don't currently have a hazard for. If that makes sense. So like in the southeast, there may be a few places like in Tennessee and others that could have all 3 and they could simulate all 3. But if you live in an area that doesn't have a seismic risk, there's no seismic data for you to simulate. So that's one of the conditions right now, is that we need good data to make this realistic. And there's some other questions. Could it do other types of concurrent disasters? Yes, certainly. We need good data coming in. So it's not just meaningless words that are generated. It has to be based on agency data, partner data, and hazards data. For the purposes of this demonstration, we made the sim designer allow for wildfire. But if you came in and had selected pandemic ice storm and then came into the sim designer and say, I want to change to wildfire, it won't let you currently because the data isn't there right now within what we're ingesting. Okay, so everything is technically possible with enough time and resources. So this could be expanded to other disaster combinations. Jesse, anything to say on that? I know we want to do everything, right? So
yeah, I mean, absolutely. I mean, our interest is to be able to put other, combinations and ensure that we can help the jurisdictions to be able to, really prepare for addressing the additional burden that comes when you have these, concurrent or cascading events. And we're seeing more and more of these happening. We have talked about being able to pair different disasters rather than just the pandemic with another disaster, but 2 of the other options on there. So what Justin's point is, though, is we went through months and months of working through on the modeling for these in order to ensure that the hazards were relevant. And so we actually, created, how many different scenarios, Justin, on some of these?
Oh my God. Yes. Yes. So
thousands of scenarios to accomplish this. So each hazard, we talk about modeling wildfires and where they might go based on, prevailing winds and fuel sources and the rest. Really takes a lot more, time and engagement energy to do that well. So we went with those that we could get and turn out within the time frame as well as within the budget that we were allocated. And then based on feedback and user sentiment, I think this is where we have the opportunity to say, all right, what is the next phase? Where do we go from here? But we wanted to get something where we could get all the jurisdictions to have at least one of these hazard pairings that they could use to be able to do an exercise. And then based off of your all feedback and, pending resource allocations and availability to support this is where we would move forward with increasing the options there around the hazards.
So there's a few more questions that came up in here. One of them was around trying to find it. What are the common reservations about using such a tool like this? I think we probably spent a year between me, Jesse, Kim Schoaf, Tim, and some others discussing like reservations around the use of AI, how to make it useful, but maintaining privacy. Like one of the things around not ingesting staff names was a decision around privacy. So the common reservations are, where's my data going? Who's hosting it? Where is it going to be shared? Things like that. And so I think where it's going to be housed within the stewardship of NEHA is a really appropriate place. It will be SOC 2 and HC compliant. It's not immediately shared with any other agencies or anything like that. So NEHA is a pretty great steward for this, and it allows for us to learn across the nation. So it's not individually on premises hosted by each user. That would break some of the learning that we could do. There's another question here about what's the so what at the end of this, the simulator. The simulator pumps out a summary report at this point, which captures everything that you inputted during the simulation process, plus all of your decisions around staffing allocations. And it produces a very nice PDF report that you could read, you could take to leadership, you could review with an administrator or a group after, say, what do we need to change for our staffing, and run this simulation again. We had a lot of talks over the past year about that you're not supposed to immediately win this simulation. And a lot of tabletop exercises, you almost come out like you're meant to win. This one, you're supposed to run through this multiple times and try and optimize. It's not an immediate, let's get them to win. Okay, it's to help you identify challenge areas with your resourcing. So
if it's not helping you learn and it's not helping you uncover some of the challenges and giving you an opportunity to restructure things a little differently and allocate your human resources different, we're missing the mark of what we're trying to do. Because we recognize the current way that we're working has many gaps that actually put us at risk for thinking we're ready, when the exercises and plans that we have may actually be not anchored in the reality of the resources that are available and that will actually come together in the event of a disaster. And so working through that and ensuring that you have the opportunity to allocate resources, and then when you look back at it and see where you put some of those individuals and the skill sets that they have, where you could allocate those differently to ensure that you have the right people at the right place at the right time, is really the goal here. And so that iterative process, over the course of time allows you to be able to learn from those both mistakes and opportunities within here. And you have a database from the enumeration process, which gives you a good, strong understanding and a way to connect with all of your resources across your agency. So that is a standalone piece that you're able to draw from when you are working on any activities, because now you have an enumeration of the capability and capacities across your jurisdiction, which is a vital component that has a lot more merit going far beyond just this initial piece.
Mm-hmm. So any last questions? Well, one just dropped. What's next with this tool? Let's see, I'm reading. I have absolute interest in all of that. I don't know if everything is technically possible with time and resources, Dan. So I think what NEHA has done really well for years is focused on a vision here. I only came in the last year to add AI things, but they focused on a vision, and they have a roadmap. So it's important to produce on that roadmap and stay focused. And they've produced something in the past year that, and Jesse, I think you should also address this, that like it was a combination of public, private, government, academia, practitioners to make something that seems pretty easy. But I would say I think we quantified at some point just how many hours that went into this between like the 5 core folks. And so there's always another thing we could add. So I think we just need to, what's the next most important thing to add? What's the next demand signal? And that's the direction we should go. And so if you have ideas, certainly give them. Like, we love ideas. It's just, how do we navigate on that roadmap towards something that's logical and meeting the most demand? So
I think that's well answered. And I think, when you talk about, geographically isolated communities, Daryl, thank you for that. Absolutely. We want to ensure, when you're mapping out your local considerations and challenges. We've done some demos with this in some of the territories and freely associated states, and in some more, smaller jurisdictions that may be surrounded by others or may be more isolated. And so when you have individuals that have multiple hats on, the question we're asking isn't just what the environmental health workforce is doing. It's how are we addressing these types of hazards? And we know it takes more than just the health agency even. That's why we have included the ability to also engage with partners and map out those resources. Because ultimately the question we're trying to ask is, are these capabilities and functions covered within your jurisdiction? And who is using them? And if not, what are the gaps that exist? That information can then be used along with decision makers to inform on where to prioritize investment and focus to ensure that you're able to better prepare and support your jurisdiction should these disasters strike. And so it becomes a tool both for advocacy, for understanding where you stand, and then for making plans, whether in the short or longer term, on how you can begin to address those, even in more resource limited or isolated jurisdictions. So we are looking for early use adopters from all. So we'd love to have the rural and frontier alongside with urban large jurisdictions so that we gather feedback and understand and can work through with them, learning together how this best helps to support them and where it could be, refined or enhanced, where we should focus, next steps along the path to development. So great questions. Really appreciate all of your feedback. There's probably many others that we haven't captured, so would love to hear from more of you. There is also some questions here regarding expanding it to international level. That is absolutely something that we want to make possible. There are specific data protections that have to be addressed that go beyond what we have currently with SOC 2, but quite similar. So those are things that we are looking at, what it would take to be able to make that available, because we do believe that it has, global value to be able to be utilized. So Henning, thank you so much for that comment and question as well. So once again to the panel, any last comments before we close out? I appreciate your support from each one of you, but open up for one last round.
Stockton, you want to go first? If you have anything?
No, I don't have anything really to add. I mean, in the brief thing that we just did, I think you can look at it and wish we did more, whatever. And I think that's the cool thing about this. You can grow it or shrink it as much as you want. There's a lot of things I didn't add from emergency management that could have changed things. And so I think it's beneficial because you can kind of play with it based on your conditions in your jurisdiction. And so I think that's going to be the most useful thing for people, is just getting in the simulator and running things that may not ever occur in your jurisdiction, but it'll bring up things to think about and plan for.
Thanks, Stockton. Sandra?
Just that I'm really excited about this, and I think this is going to be an excellent tool for everyone to use, and just want to make sure we keep moving forward with this.
Larry?
Like Sandra talked on, it's a really great tool to use. It makes life simpler instead of having to spend hours putting things together. This does it in a very short time. So I think it has a lot of potential for assisting the environmental health practitioner in responding to disasters. So I hope we continue its development.
Megan?
I was just thinking about kind of some of the challenges that we built into the simulator around workforce, right? And the limited resources in an emergency, those exist every day. And so I think this really provides a resource for the understaffed, departments across all of the nation that, have one person or half an FTE working on environmental health and public health who can't really spend their time developing a robust exercise. That this really lets them expand their capabilities or their capacity during routine time to prepare for disasters.
Great. Yeah, I imagine a half an FTE EPH officer just producing scenarios and sharing them with EM, saying this is why we should be in the EOC. This is why, and just every week having a lunch running a scenario could be done. So running a simulation. So Tim, you have last panel word, and then it'll go back to Jesse. And
yeah, great. No, I think this is really important. Having done public health preparedness for over 2 decades, you get in a room with the same old people with the same ideas. And one of the things that I think is important here is we've got that outside person that's going to be, I say person, this AI tool that's going to be bringing in other thoughts that we go, oh, we hadn't thought of that. So very, very important in the days of having a static document on the shelf is probably coming to an end. And I'm glad of that.
Thanks, Tim. Jesse?
Yeah, thank you so much again to everyone. Just those who might be wondering kind of what is next. I mentioned that as you sign up for being on the wait list or showing interest in this, we will be reaching back out as we identify a handful of jurisdictions that we're going to work with as the early adopters. Also, just for your awareness, next week we'll be doing some engaged facilitated pilot engagement activities. We'll be doing this in Alabama and also out in Washington State. And so based on that engagement and feedback, that also is another way that we are working to specifically understand how this meets the needs and is understood and can be utilized by the jurisdictions. So we are excited about engaging on that, looking forward to hearing back from many of you with interests in continuing an engagement. And we will go ahead and close for today. Wishing everybody a great rest of your week.